And that's, you mentioned disease. And I wonder how many people look at it like that.
I think a
Like
lot
it's
of
a,
people do. And I think, and that's why you have to be careful. Like, I love, love, love all of the attention that menopause is getting. I love that I'm in menopause during this very important time when all this research, all this discussion is happening, because I don't think women who are older than us had that benefit.
Right.
So I am all for it, but I do think that sometimes the marketing can depending on where you land, it can create a problem in people's head, or think it's something that needs to be solved.
Right. When we just literally have to go through it.
Yes, and now on that same token, you don't have to suffer through it.
Right. Right. Again, I could have saved myself a lot of, had I really just had
Yes.
additional conversations around
Yes. Yeah.
what could help.
Because I started HRT when I turned 50. I might have been late 40s, 50, but I really should have started in my early 40s. Because that's really when the symptoms were most uncomfortable, for sure.
Life keeps changing, and I keep aging. Turn my stress into blessings. I'm here to share my lessons. Tracy Marchelle.
Hey, girl. Hey, thanks for tuning in to Girl, I'm Making It Through, the podcast where we talk about life after 50 with all of its challenges, surprisings, and beautiful new beginnings. I'm your host, Tracy Marchelle, and I'm so glad you're here with me today. Now, you know, on this show, we keep it real. We laugh, we share, and we learn together, because making it through isn't just about surviving, it's about thriving. So make sure you like, share, and subscribe to be among the first to be notified when new episodes drop. Today, I'm thrilled to welcome a very special guest, Dr. Songhai Barclift, founder of Harmony Wellness for Women outside of Atlanta, Georgia. She's not only an incredible OBGYN, but also a passionate advocate for women's health and wellness, especially for those of us navigating the unique season of life after 50. We're going to dive into the conversations that matter, like the health challenges women often overlook, how to care for our bodies through menopause and beyond, and why self-care and sisterhood are essential parts of aging gracefully. So grab your tea, get comfortable, and let's get into this empowering conversation with Dr. Songhai Barclift, because, girl, we're making it through together. All right. Well, welcome to the show. Thank you so much for being here. I wanted to get together with you to have this conversation about life after 50 from a medical perspective. So welcome.
I love that. Thank you. Thank you for having me.
I wanted to ask you, how long have you been in the gynecological obstetrics field? And what made you start Harmony Wellness?
So I've been in OBGYN, obstetrics and gynecology, for approximately 25 years. And I count that like that's when I became an obstetrician gynecologist, when I graduated residency. But it's really, I mean, anyone will tell you a practice of medicine, it's a practice. So, it's evolving. And now that I am a woman of a certain age, I'm in my 50s, Harmony came to me as like another chapter in my life. And it also was an opportunity professionally to kind of take charge of how I wanted to practice medicine.
Oh, nice.
And how I wanted to leave medicine, because I anticipate, retiring from Harmony.
Okay. That's amazing. And I did have a chance to look at your website, and it's not just all about OBGYN. Like, it's almost about, and correct me if I'm wrong, whole health of women.
Oh, you're absolutely right. So the idea is, and anyone who's spent time in an OBGYN office, you're doing a lot of behavioral health. You're doing a lot of preventive care. For many women, you are their only doctor. So I wanted my space to incorporate that. I wanted to make wellness simple. That's my motto. I wanted to offer a practice that could, at the very least, get things started on a number of healthcare fronts. So behavioral health, your preventive health. And I also wanted to offer some, new things that, we think about, we might read in a magazine and you're like, oh, I wonder about this. Like, where would I go to have that done? And I wanted to create a practice that at least gave women a inroads into that type of healthcare.
Which you don't find now. For one, going to your OBGYN, finding one that takes the time. Nowadays, especially, is they're in, out the room they go. To have a woman that gets it is critical, would you say?
It's
Or
paramount.
doctor period that gets
a
it.
doctor
Yes.
period
Yes.
that gets it. And I'm a big proponent for women and men and anyone else. You have to trust a doctor, and there's a doctor for every person.
Right.
So doctors are people too. So you have to match personalities. You have to match vibes. You have to be in a situation where you feel heard. And for different people, that's different things from the care provider. And yeah, I pride myself in being a good communicator with my patients, being a team player on the whole wellness journey. Like healthcare, wellness, how we feel, how we grow old. It's a participatory sport. Like, you can't just sit on the bench and say, well, I went to the doctor and the doctor said this or the doctor didn't say that. You really have to be in a partnership.
You do. And you have to come to, just my personal opinion, and I try to do with my visits to the doctor, come prepared. I do my own research on what I feel may be going on, and I have questions.
Yes.
And I need you to answer my questions.
Yes. And I think it just depends. I'll just harken on my own personal experience. Sometimes when you go to the doctor, as a woman, as a Black woman, you have to feel armed. Like you're going to court. You're trying to prove a case. You're trying to get what you can get or what you think you're supposed to get. And I really challenge people to seek out providers that you can trust.
Yes.
So that you can, bring your concerns to the table and feel comfortable with that person's ability to decipher whether things are serious or not, to lead you in the right direction. And if you don't have that, the relationship can be very contentious, and that's not where you want your care provider team to be.
And it's not conducive to
It's not.
you getting better or getting the care that you need. And I've talked about on a previous show how Black women are often overlooked as far as our pain and different things that we endure. And it's hard to accept that, but it's real. But
And it's hard
real.
to know what to do with that.
It's hard to know what to do with that.
It's hard to know what to do with. I mean, historically, and I'm not like a expert on it, but there have been a number of, well-developed papers and things that talk about just precisely that, about traditionally our pain. We have not been perceived to have pain. We are not responded to in the same way that others are responded to when they express pain. And what does that do to our sense, our connection to our body over time? And then we bring that to the care setting, right? How does that look? When you have a person who really doesn't trust you, doesn't trust what you're about, or a person who's disconnected from their body because no one has allowed them to be connected and to be validated in that connection. I can't tell you how many women are just afraid and, not to have a provider that can deal with the fear, the anxiety. Many of us have dealt with, health situations with family members or maybe a mother, a sister. And so there's a lot that has to be overcome.
Just to get care.
Just to get care and to receive care.
Right.
So it goes both ways. Like, you need somebody who's actually going to be offering good care, and then you have to be open to receiving good care.
And I'm finding now that providers, there's not a plethora of providers like there used to be. It's almost like the profession of doctors are, they're not taking new patients. Like you have to really do some homework to find a provider, develop a relationship with that provider. If that relationship doesn't pan out, now you're back on the hunt again, and how does one navigate, like, is it just speaking up to say, hey, doc, listen?
I think it just depends on your provider and what the relationship you have. So I will just, in defense of everyone involved, the healthcare system at its worst doesn't work for providers or patients. So they're just as frustrated as patients are. I can tell you in the interactions and the demands on them. There's a certain, you talked about spending the time with you. Well, there's certain models of care that time is not even afforded for patient care. So, you want the doctor to spend time with you, but there's nowhere written in their day that they're supposed to be spending that much time with anyone. Right. So there's that aspect of it. And then there is the opportunity to build a relationship. A lot of times, I just know for myself, you get a good provider and then you come back and they're gone. Or they are not seeing you because, such and such is seeing the patient or whatever. So there's a lot of just kind of tracking that down and really working hard to create a relationship. If possible, I try to do this with my patients to the extent possible, is when you are a new patient that you actually make an appointment for just talking. Not for complaining, but just letting the person know who you are. This is what you've dealt with. They're taking your history. They're getting to know you. They're maybe hearing your concerns, but it's not about actually diagnosing and treating. It's just about
excellent idea. That's an excellent idea.
Yeah. And if you spend your 15, 20 minutes like that, then the next visit, you already have a rapport.
And, and probably that initial visit, they're more engaged.
You're more at ease.
Yes.
So to the extent possible, if you can do that, that would be ideal.
Okay.
Yeah.
Well, let's switch gears a little bit because you did mention you're over 50.
Yes.
Have you started experiencing menopause yet?
Oh, yes.
Okay.
Yes.
And what is surprising to you about it, especially in you're a professional, medical professional. What has been surprising to you in your experience of menopause?
So, it's really weird because just on a personal level, I definitely went through menopause in my 40s and had just a plethora of symptoms. And I tell this story often to patients and whoever will listen. I was in the doctor's office and complaining of things, because, I have a little bit of a hypochondria going on sometimes. And so people were just looking at me like I had 3 heads. Like, what? What are you talking about? You feel like things are crawling up your legs. What?
Right.
What are you talking about? And, and then I had to check myself. Like,
do I really feel that?
I know I felt it, but like, okay, what are you presenting with? I had to be my own doctor. And then, I'm one board certified OBGYN talking to another.
Right.
I don't blame them, but we both were a little mystified when we realized when I realized oh, this is all menopause. And for me, it was validating. And you have to understand that many of the symptoms are menopause, and there are a number. There's like a whole litany of things, the way that the decrease in the hormones can affect you. That it's a diagnosis of exclusion. So a good doctor is not going to take whatever you say and say, oh, that's menopause, because you really have to exclude all these other things before I'm now going to chalk it up to menopause.
Okay.
That's one thing. And that's really important because menopause collides with middle life when women and men, these chronic diseases start popping up. There are people who are getting, more serious illnesses. So it crossroads with a time that is fraught with real diagnoses, right? So you want someone to take you seriously. And if they then say, you know, like, hey, it is menopause, don't look at it as like, oh, they just ignored me or they minimized it. It just means that it's not, you know, some random serious disease. And that, you know, more than likely we can treat it with symptomatic management.
Got you. And I know my doctor ran blood tests to check my hormonal levels.
So the blood
To
test,
say.
yeah. Now the blood test is a bit controversial because I think it was just recently I read that the American College had released a statement basically saying that there's only rare cases where blood tests are needed, right? Now, I can't tell you how many women who have come into my office and said, I would like my blood levels checked, right? They don't know which ones, but they're like, I want some blood work and I want to know what's going on. And I think it's basically like there is no one test that you can do, boom, you are menopausal. It does not exist. There are trends in your hormone levels that can tell you at the time that I take this test, this is where you are. But especially in the perimenopause, when women are still menstruating, you can be hormonally 16 one day and 60 the next day. Like that's how variable
Interesting.
the swings are.
Interesting. Interesting. Yeah. So you mentioned you started in your 40s. Now, is there such a thing as early menopause? You hear about early menopause, perimenopause,
Yes.
especially in women that may have had a hysterectomy or, you know, different complications with their menstrual cycle.
Yes. Yes. So without getting too technical,
Yes.
there is considered an early age for a woman to stop having periods. And there are certain autoimmune disorders that are associated with that. There are certain chronic diseases that could be associated with that. And just to make sure that women understand, just because you have a hysterectomy doesn't mean that you are in menopause. So a hysterectomy means your uterus was removed. If your ovaries are still there, you are not menopausal.
Okay.
Meaning that your body is still making estrogen. Now, you're not having a period, you are not cycling. So technically, if you want to define it by a period, yes, you are menopausal. But hormonally, you are not.
Okay.
So that's the difference. Now, some women do have, depending on why you had the hysterectomy, they also have the fallopian tubes and ovaries removed with the uterus. When that happens, then yes, you are considered menopausal in the sense hormonally, and you're not having periods. So that is when women who are younger that have that type of surgery, they are placed on hormone replacement. And all women who have their ovaries removed, unless, there's always caveats, unless it was for a cancer diagnosis or something that is made worse by estrogen, they will undoubtedly need hormone replacement therapy.
Which brings up a great point. I had a hysterectomy, 2007. And my doctor talked to me about hormone replacement therapy. And the first thing came to my mind, estrogen. If I'm taking estrogen, I heard it causes cancer or, you know, all these other things. And heard it secondhand from the previous generation. Like it's been going on forever that people think if you take estrogen that you could get cancer from the estrogen.
You were in good company.
Okay.
Because, and I won't say it's so much cancer, but there's a lot of complexity. So there are complications that we call like vascular complications of estrogen. So stroke, deep vein thrombosis, pulmonary embolism, which are all very serious, which are increased with estrogen.
Okay.
Okay, but there's caveats. There's dose. There's the age that you are. there's existing disease that predisposes you to that kind of stuff in the first place. So all of these things have to be factored in. And then there was a huge study. I think everybody knows about the WHI study, how it was stopped prematurely, and how it created almost like a backlash against estrogen. And in fact, in certain delivery modes and certain women, especially if you were recently menopausal, the estrogen is in fact promotes health as opposed to creates disease or puts you at risk for disease. But these conversations really, they are designed, and that's why I'm being very general.
Yes.
Because they are designed for you and your provider to talk with you about your particular situation.
Because everyone is different.
Everyone is different. Everyone's family history is different. Everyone's current medical status is different. Yes.
And everyone experiences menopause differently.
And everyone experiences menopause differently.
Yeah.
Mm-hmm.
Yeah.
Mm-hmm.
Well, thank you for that information, because it's worth a conversation now with your doctor.
Mm-hmm.
Because, again, we went on what we were told before, and without much research or knowledge really about what that meant. And it made me think, okay, I should have asked more questions, about it. Whereas I chose not to do it at all.
Yes.
And kind of suffer through some things that I might not have needed to suffer
Yes.
through.
Yes, that is precisely the case. And that's the risk. And to be honest, like as we grow older, this is not the same 50 as my grandmother. I'm not the same 53 as my grandmother was at 53. And our expectations for our lives, for our sex lives, for our ability to work without being distracted by hot flashes are different. So we value different things than maybe previous generations did. And so that also has to factor into it, your quality of life.
Yes. Mm-hmm. Yes. So definitely worth a conversation with your doctor.
Yes.
More in-depth conversation about it, which I will be having now, knowing that. So what's the most misunderstood or overlooked symptom of menopause that women have? What would you say?
Misunderstood or overlooked. That is so difficult because
it probably looks different for each
individual. But I would have to say the one that probably is, this is just based on patient interaction, that I think is most surprising for women, is they consider the, it's now called genital urinary syndrome of menopause. They consider the changes that happen to the vaginal skin, to the vagina, to the vulva rather, and the vagina. People don't connect that with their hormone levels. So it can be everything from pain with intercourse to vaginal dryness during intercourse to just irritative symptoms. I've kind of like heard about, Halle Berry when she complained about how she was diagnosed with, or they suspected she had an STD, but it was actually just vaginal atrophy.
Yeah.
And so I think that probably is the one that surprises a lot of women because women feel like,
that's surprising me now. Like,
I don't have hot flashes. I'm fine. Like a lot of women are like, yeah, I'm good. But they have these symptoms, it can be urinating frequently. It can be a little pain with urination. You're like, oh, I have UTI. It doesn't really feel like UTI. Like, what's going on down there? So I think that's the one that probably gives women the most, the most trouble kind of equating with their hormones.
And quite honestly, that's the first time I've ever heard that. Having the irritation due to your hormone levels. I think the most surprising for me, and I remember my doctor saying, now, after the hysterectomy and you heal, you may not want to have sex, and that may be an issue for you. And going back in his office, I was like, I want it all the time. He was like, what?
Yeah.
I said, no, I wasn't in that category of not wanting it.
Somebody said to me, it's cougar puberty. That's
Yes.
what they say. Cougar puberty.
Oh, that's a good way to look
I
at
thought
it.
that was hilarious. No,
Yes.
but that's true. So a lot of women think that changes in libido, number one, are required in menopause, and that is not true.
Right.
And a lot of women do have increased libido, and I don't know that that's necessarily hormone related, or is it just kind of, I feel like it's a time in your life when you're a lot more accepting of yourself. You are a lot more in tune with yourself. And I think that brings about an increased libido. I think that kind of heightens your sexuality. It's also a point when people are empty nesters.
Yes.
It's also a point when, your child rearing responsibilities are not as great as they were maybe in your 30s and 40s. And maybe you're over the career by now. You know what I mean? Like you had your career, you know
Lots
how
of
to
things
do
could
everything.
be going on,
Yes.
to encourage
Yes.
that. But I think for me, it was the freedom of pain.
Yes. Now,
That just was like,
many women who have hysterectomy for like fibroids,
Yes,
pain,
and that was my issue.
that's documented. They will say they have a better sex life
Yes.
than always worrying about whether they're going to have bleeding or being uncomfortable. There's a lot of painful things that can happen with the uterus that once you remove it, women feel so much better.
Liberated. Liberated for sure. And let's switch gears again a little bit and talk about the difference between aging. I mean, we've talked about menopause, and we chalk up menopause as aging. Where can we say, like, it's normal? What's the normal difference between just aging and it being a serious health concern? And that may go back to what we previously discussed about having the conversations, with your doctor, and they going through the different conditions before just saying it's menopause.
No, that's absolutely correct. So there is and this is why the relationship is so important. So you want to track your symptoms, because if it's menopause and we're replacing the hormones, it should at the very least get better, right?
Right.
So it shouldn't be getting worse. And if it is getting worse, it's probably not related specifically to menopause. And so I think that's probably the biggest thing. Like, you can't attribute everything to the hormones. Now, aging, getting older, menopause is a natural part of our life cycle.
Right.
So in itself, it is not a disease. And so many women go through menopause and they don't even notice it. They were fine. They were like, oh, I had a little blah, blah, but then, I was good.
And that's, you mentioned disease. And I wonder how many people look at it like that.
I think
Like
a lot of people do. And I think, and that's why you have to be careful. Like, I love, love, love all of the attention that menopause is getting. I love that I'm in menopause during this very important time when all this research, all this discussion is happening, because I don't think women who are older than us had that benefit.
Right.
So I am all for it, but I do think that sometimes the marketing can depending on where you land, it can create a problem in people's head, or think it's something that needs to be solved.
Right. When we just literally have to go through it.
Yes. And now on that same token, you don't have to suffer through it.
Right. Right. Again, I could have saved myself a lot of, had I really just had additional conversations around what could help.
Because I started HRT when I turned 50. I might have been late 40s, 50. But I really should have started in my early 40s. Because that's really when the symptoms were most uncomfortable, for sure.
Yeah, so I was 47 when I had mine. 47? 37. 37 when I had my hysterectomy.
Yes.
And it could have saved me a lot of headache, because I did start going through some of the things.
Yes.
It wasn't as consistent as it is now. But I've also found some, natural ways to kind of, help me along. And a lot of that's even it's trial and error, what works for you,
very
what
much so.
doesn't. Like you mentioned, dosage and, even on the herbal front, it's all about, like, you still have to look at that as medicine, even
Oh, you
though,
definitely do.
yeah,
Especially if you're trying to replace estrogen. So if you're someone who should not be on estrogen for medical reasons, and then you replace it with herbs,
Right.
right? You may be replacing it with the same type of risk that you would be taking with medical grade estrogen, because it's acting as an estrogen in your body. It's stimulating those same receptors.
Yes.
So you have to be very, very careful.
And again, because I know on the forms, they ask doctors' forms that you have to fill out. They ask you, are you taking any supplements?
Yeah.
And that's why it is very important still to, even if you are going the natural route, still discuss that
Oh, you
with your
most
doctor,
definitely
right?
should. Like, there's a group of people out there that if you just say natural, they're like, "Oh, I'm down."
Right,
And
right.
they'll pay for it, they'll get it, and without really understanding, like, what am I taking? What is it supposed to do? What is the downside? Because if you truly believe in herbs and you believe that herbs are medicine, which I do, then you should have the same scrutiny that you do for when you pick something
A
up from the
prescription up.
pharmacy.
Correct, correct. Okay, good, good. And I'm glad we touched on that, because I find like I'm looking for alternative medicine for a lot of things as well, but they do. And my doctor, she is great about also recommending
Yes.
things on that front, but she said at the end of the day, Tracy, it's still medicine.
Yes.
So if you're doing those things, I need to know.
100%. And a lot of people have functional medicine doctors in addition to their quote traditional doctors, and that's fine, because they both have expertise in different areas. But you better make sure that they're talking. Like they should
Right.
not be. They should be very familiar with what each other is prescribing, what goals that they have for you, what they're trying to prevent, or what have you. Like the plan should be complementary.
Yes, and I do. I also have a natural doctor that I see, and I discuss that with my doctor, and vice versa.
Yes,
My
yes.
doctor said this, and that I should, with both of them, so we're all on the same page as
Right.
far as my care.
I love that.
So, definitely you have to have that conversation. Now, in this midlife, what type of blood work, and we touched a little bit about the hormone blood work, but what type of blood work us in our 50s should make sure that we're getting?
Yes. So, I mean, again, I'm going to sit and talk to you. So I don't have any like, this is what everybody's going to get all
Right,
the time.
right.
I'm going to talk to you and figure out and think about what I would like you to have. But I think at bare minimum, an FSH, follicle stimulating hormone, is helpful. It is not going to tell you whether you are in menopause or not, but it is helpful to see a trend, to see where you are. And I find it helpful that if you eventually do get hormone replacement, it's a good hormone to look at periodically to see if we are giving you enough.
Okay.
So that's one thing. I like a TSH because that is thyroid stimulating hormone. Many women have hormone problems, either Graves or different types of autoimmune thyroiditis and so forth. And a lot of times those symptoms mimic menopausal symptoms. So I've caught a lot of thyroid nodules and thyroid issues just because we're doing a workup for, menopause, but in actuality, the palpitations, the irregular bleeding, the dry hair and nails, like it had nothing to do with menopause, but it did have everything to do with the thyroid.
Okay.
So at a minimum, those, and then I check basic like liver, kidney function, and A1C at the very least to check for diabetes. And then a big thing that women really need to understand, we all want to protect ourselves from breast cancer. We all are very aware of breast health. But the reality is most of us are going to die from cardiac disease. And so it is imperative, like you just have to tell me you have like the smallest symptom, and I want every woman in that 50-ish range to have a cardiac workup. Everyone should have had a stress test of some kind, just to see where you are, because those blockages that have been building up, they then start to become more noticeable in our 50s and 60s.
Interesting. And I especially if you have a history of heart disease
Oh,
in your
for
family.
sure, for sure.
So that I'm glad you mentioned that because I have not. I do have history of
Yes.
heart issues in my family, and I need to do that.
Yeah, and that includes like the blood pressure, the cholesterol, the triglycerides, and baseline EKG. Like I mean, probably you had some
I've
of
had
that done when you
EKGs, I've
had
had
your
some of that.
surgery or whatever.
Yeah.
Sometimes along the way, we've had to have that for whatever reason. But I'm going to make sure that if we have even the slightest risk factors, family history, our weight, our blood pressure, whatever, that let's see what we're doing on the cardiac front.
Okay, great point. Great point. So, what changes in intimacy would you say are normal after 50?
Changes that are normal. This is, and I'm not speaking as I'm not a sex therapist or anything like that. I do think it is, I'm not going to say normal, but it wouldn't be abnormal if the frequency of intercourse or the desire to have intercourse is less than in your 50s than it was, let's say, in your 30s, right? A lot of times I ask my patients, when you do have intercourse, is it enjoyable? Is it, satisfying? Are you able to have intercourse? And if not, then why? Because your sexual health is a really, really good indicator about other things. Your mental health, your vascular health. Yes, it is very much an indicator of other things. So, and it shouldn't be, I don't think it should be like a drastic decline. Like, I used to be this and now I just don't even want it anymore. Okay, I'm asking more questions.
Okay.
I'm asking more questions about your relationship, about, what you're experiencing. Now, granted, there's a lot of things going on during that time.
Yes.
Our partners may be ill. And so therefore the sexual contact is not, it's not available. Okay. Then I also ask about intimacy. Like, are you enjoying intimacy? Like, are you, so maybe not like actual sexual intercourse, but are you getting affection the way you want to? Are you feeling supported the way you want to? Do you feel alone? Do you feel valued? Because all of that goes into that.
Right.
All of that goes into it. And
whether you even want to have sex, if none of that is happening.
yes, yeah. Because if you don't feel valued, do you want to have sex?
Right.
Like,
No.
probably not. Probably not.
Right,
Especially us over 50, because it's all mental for us.
Child, listen. Get out my face.
But I do find that I hear many women, I don't have any study, but many women have enjoyed like a good sexual life or a robust sexual life, better sexual life. For myself, I feel like my 50s has probably been the best time for me because it's the time that I've been most balanced.
Yes, and that's a great point.
Yes, yeah.
Excellent point. And I will have to agree with that because now I'm at the stage where, you know what, like, I'm just not dealing with things like certain things are not even in my peripheral anymore. I'm more liberated. I'm more free. Not raising children.
Yes.
I'm a grandparent now, so it's like, oh, I don't have to worry about the day-to-day of kids. So life is different at 50. I'm free to just live. So,
and if you embrace those differences, a lot of that can equal better sex, better intimacy, more satisfaction.
And vaginal dryness is another issue with intimacy or having sexual intercourse that women are even afraid to talk about with their doctor. I don't know why, but especially if you feel like you want sex, like it's a whole health approach. Like,
that's why it's a conversation.
Right.
It's a conversation because, I can ask you, are you sexually active? And the patient can say yes, no, right? But if I don't follow up with, No.
Or what are you
Well,
experiencing?
why?
Right, or
And
right.
no, well, do you want to be?
Yes.
And, is this a source of disappointment for you? How does that play out in your relationship with your partner? So you have to kind of like peel back the layers, so to
Yes.
speak, to get that. And I think vaginal dryness is definitely an issue because it makes sex painful for women, and it can make them like, well, I don't really want to do it. It's not that they don't want to be intimate; it's just that it's not comfortable.
Right.
So it's not.
And also
preferred.
uncomfortable for the man if you're dry. Like you have to,
Yes, that's a good point.
Yeah.
What does the partner experience? That's a very good point. And, one thing about vaginal dryness, it's very easy to fix.
Yes.
Very easy to fix in the vast majority of cases.
And so one question on that, and this is just an anecdote for me. Like I've talked about natural. Coconut oil. People use that as a source of lubrication. What are your thoughts on that?
So, I mean, I've never used it personally,
Right.
so I don't have any
And my reason for asking is because I know with certain other oils you can cause bacterial infections and,
Well, okay, the bacterial infections is a whole other thing. I'm not going to say
Okay.
the oil causes it, but
Okay,
you're in an
okay.
area, you're dragging it in oil. It's probably not as mobile in oil, all those
Right,
other
right,
things,
okay,
right?
okay.
Changes of the pH, I
Okay.
don't make me go scientific
right.
here, Tracy, but I have heard coconut oil though from patients.
Okay.
And some of them swear by it. And I think it's pretty inert. Like, I mean, I don't like, again, I've never tried it, so I
Right.
can't say, but I have heard that. And it probably does work. Like, why wouldn't it?
Right.
But I will say that true vaginal atrophy usually is not cured with oils.
Okay.
Because it is a lack of estrogen effect on the vaginal mucosa, and it creates not just a dryness but a fragility too of the vaginal mucosa. So it's more readily treated with estrogen, to be honest. But I mean, I think if it works for women, I mean, I'm not going to prescribe it, but
Right.
if it works, I don't think there's anything wrong with it.
Right.
Yeah.
So I recently had a mental health therapist on the show, and we were discussing menopause, and she mentioned like 3 things that a woman should subscribe to help with the symptoms, right? One was diet, exercise,
I agree.
and the third was sleep.
Oh, sleep is so important.
But let me tell you, at this age and in this period, sleep escapes me. And so many other women, like, what the
It's
hell?
hard
Like,
to come by. Okay, so I have to quote one of my patients. I'm not going to say her name, but if she listens to this podcast, she'll know. So I have a whole assessment that I do with every woman over 40, whether
Okay.
you're coming to me for menopausal symptoms or not, just because of what we talked about in terms of like, being able to ask the right question
Yes.
to get the right information. And so I said, "Oh, how's your sleep, Miss Such and Such?" And she said, "My sleep is trash." And she said, "My sleep is trash."
I second that.
So that is huge, 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 huge. And that is also one that takes a little bit of tweaking. So we have a lot of things in our armamentarium that we can help with sleep. One of the first things that I will start with if a woman is able to take it is progesterone. Micronized progesterone does wonders for your sleep. So even if you're not ready for, estrogen and, full blown whatever, a little whiff of progesterone in the evening, I can't
Whiff of
say.
it. Is it something you
Well,
inhale
I say,
or
no,
peel
it's
or
a pill.
Okay.
It's a
okay.
pill.
I'm like, wait a minute.
So yeah, I think if we're going to do the hormone talk, we got to bring progesterone in the picture because
Okay.
progesterone is it is not a hormone that's, quote, replaced when we're talking about traditional hormone replacement therapy, but it is a hormone that is needed because it counteracts the effects of estrogen in the uterus. So for women who are on hormone replacement therapy, let's say for hot flashes or for libido or whatever, and they have a uterus, you always have to give progesterone. if you are taking estrogen. Now, there's a little caveat for vaginal estrogens, because I know somebody's going to say, well, I'm on vaginal estrogen.
Right.
So there is the lower dose vaginal estrogen does not require an addition of progesterone. But if you are taking hormone replacement, estrogen, the traditional doses, you have to be on progesterone as well if you have a uterus.
Now, if you don't.
Now, if you don't have a uterus, I can still use it. It's not used to protect the lining of your uterus like I would with a woman who has a uterus, and that's protection from uterine cancer or endometrial hyperplasia. But it has been shown to cause a nice somnolence. Women love it. It helps them sleep. And
Interesting.
Yes, yeah. I'm telling you, we got tricks. Yes.
Wow. So yeah, this will require a follow-up conversation
Yes,
with my doctor
yes.
because when I tell you they want to go straight to Ambien, to Trazodone, like all the things that have all the side effects, instead of getting to the heart of the matter, and as I mentioned, like trying to not be on like prescription, so many prescription medications. I don't want to do that.
If you are a candidate, I don't know your history, we would have to talk about it. But if you are a candidate for it, it is great for sleep.
Okay.
Great for sleep.
So, but again, it causes some more discussion with your doctor.
Yes.
Opens up another dialogue about helping you sleep.
For sure.
I mean, I have things that I switch from Tylenol PM, Advil PM, Benadryl. Like, switching between to find something where I could just get a good solid night's sleep.
The other part of that is, have you had a sleep study?
I have.
Because that's another thing
sleep
that creeps
apnea.
up, and women will think, oh, it's the menopause, but they actually have sleep apnea,
Right.
And in which case, estrogen or hormone therapy is not going to help at all.
At all. Right. Excellent point. So, what would your ideal wellness plan look like for women over 50? And of course, we realize everybody's different, but if you had an ideal...
Yes. I love this because we're putting together a package right now for this very thing. It would include going to your preventive health guidelines and making sure you are up to date on all your preventive health, your colonoscopy, your cholesterol screening, your pap smear, your mammogram or cytology or HPV screening, if whatever one you use, your mammogram, you make sure that you've gotten all those. Because to me, those are freebies, right?
Right.
Those are like, why die from colon cancer when you can catch it early? Why?
Right.
So let's get the freebies, right? And then let's sit down and do a health assessment and see where our tender spots are. So for you just talked about your tender spot is sleep, right? And sleep. I'm not a sleep therapist or a sleep physician, but we've all read the studies. Horrible sleep is so bad for your health because
that's your healing period, right?
It predisposes you to so much. We don't even know what happens. We know it regenerates proteins. We know all that stuff. And one thing we know, if you don't have good sleep, it's going to result in bad or worse outcomes, right? So for you said sleep. So I would do a health assessment. I would figure out what my patients' tender spots are. And I would say, hey, let's work on these tender spots. For some people, it may be, they've had long bouts of depression that they've never actually addressed, right? It's like, when I was in college, I had this and then this happened, but blah, blah, blah. But they never have really, bought into a serious treatment plan. So we would do the health assessment, right? And we would say, okay, where are the tender spots? Where are the places that we need to address? We would create a plan for that. And then we would move into what I call, so not just living, not just, surviving, but that thriving component. That where do we need to take you so that you enjoy your life?
Okay.
And a lot of times, this is the discussion that you have internally. You would have a health team to help you. Sometimes it's I'm leaving the job. I'm leaving the marriage. I'm moving
Right.
here.
Right.
Like those real conversations about how do I truly, truly embrace my life as it is. I'm not talking about winning the lotto.
Right. Right.
As
right.
it is, how do I embrace my life? How do I thrive in my life? And that would be kind of the third arm to it. Yeah.
Wow. Okay. And that's a great approach. And I think it's an awesome thing to have that with your doctor, right? But as a woman, I think you should also have these things, have those discussions with yourself just about life in general.
Yeah, of
You know?
course. Of course. And then a big thing, and so this is not just for women. Many of these things I'm saying is not just women.
It applies,
It's all
yes.
of us. But we all need to have that team in our world, that crew of people that support us
Yes.
and that get us and that can be that cheerleader when we're trying to make these changes and create this feeling in our world.
We talk a lot about sisterhood on this show and how important sisterhood is. Would you agree with that? That it's,
100%.
yeah,
Yeah.
yeah. And as you go through the years in life, sisterhood looks different. Your sisterhood of people, your village of sisterhood or sisters change. As you grow or make changes in your life, elevate whatever's happening. But to have, like you said, that advocate, that cheerleader, that person that's going to be completely honest with you and hold you accountable on certain things.
Yes.
So, yeah.
And I think it's twofold. So I think sometimes we create like a standard that is not realistic. If you are a person that thrives in the sisterhood and you don't have a sisterhood, that's a problem.
Right.
That's a problem. If you are a person that does not thrive in the sisterhood and you don't have a sisterhood, that's okay.
That's okay.
And I like people because this time in our life is about accepting ourselves for who we
Yes.
are and not like, we're over that, I don't know, little girl that keeping up with the Jones, whatever you want to call it, that stage in life where we're comparing ourselves to others or where we should have this, we should have that.
Right.
No, we are now accepting ourselves.
Yes.
So I think that does a lot for allowing you to focus in on what really is for you.
Yes. For sure. For sure. And I have different sisters for different, like we all have a different relationship. There's several that, I mean, we are down by law for sure. We may not talk for months.
Oh, yeah.
But when we do, we pick right back up. It's all good. We keep it moving. Then there's some day-to-day sisters,
Yes.
and then there's some times that I don't even want to be bothered with nobody. And that's okay too.
Yes.
But they understand that. Give me the space. I give them the space,
Yes.
So, yeah, I would agree with that.
I totally agree as well.
Yeah.
I mean, I have friends who, they're just brilliant. These women are smart. They're creative. They challenge me, and I like being around that. And then I have friends that are comfortable,
Yes.
funny. I have friends that are little sisters, and then I got some big sister friends.
Right. Right.
And I love our energy at this age. I love seeing the energy in younger women.
Yes.
Have you seen yourself in a younger woman yet?
Yes.
It's a beautiful experience.
It really is. It really is. And my daughter is really like seeing her blossom into the woman that she is.
Yes,
She's
I guess that's the
35
ultimate
now.
when you have a daughter.
Yes, she's 35 now, and just watching that all unfold
Yes.
is like fantastic. So
Yes.
it's like she's getting the things I was saying to her, early, and she's applying different things that I've taught her in her life, and
Yes.
that's it's so rewarding. And I've met like the next generation of young women. They are on fire.
They're awesome.
Yes,
They are awesome. I call them the
and
new,
they're more in tune
the
than
new
we
Black
were
queens.
even.
Oh, for sure.
Yeah,
For
yeah.
sure.
So I love
Yes.
seeing it.
Yes.
Now here's a question for Dr. Songhai. right? Y'all are the worst at taking care of yourself
We
sometimes.
really are.
So while you spend your time taking care of everyone else, what do you do to take care of yourself?
Yes. So now you're getting to one of my tender spots, right?
Okay.
Right. Remember I said
well,
you do
let's
the
go through
assessment?
it. Let's go through it.
So, yeah, I mean, healthcare providers, doctors, nurses, teachers, we are notorious
Yeah.
for giving and almost feeling bad if you give to yourself. It's that real. And so I had to, in my 50s, I would say it probably started in my 40s, but definitely by the time I turned 50, yeah, you have to take charge of yourself, your happiness. You have to put up boundaries. You have to be protective, and you have to give yourself grace.
Yes.
Like that's the real gift to yourself. And I agree with you. Younger people seem to have a much better grasp on that than I feel like I ever did as a younger woman.
Yes.
But for me, I do struggle sometimes with carving out time. For instance, starting the practice, my sister-in-law is a therapist, and so she kind of keeps me in check. Yeah, and I had to take one day, like, this is a day where I'm not going to do anything. And I've struggled. I mean, there's many of those days. I'm not even going to tell you what day it is because you're probably like, girl, you sent me an email on that day. You sent me a whole email that day. You don't take that day off. But just acknowledging like, no, I'm clearing this space for me.
Yes.
And that goes with physical space, emotional space, financial space. It's like, no, I'm fine with clearing this space for me. And I've had a horrible lesson on what happens when you don't take care of yourself. And this is probably the heartbeat behind Harmony is I've had horrible losses of women in my adolescence. I lost my mother when I was 19. Her sister passed away 3 years later at 54. So, that was like the matriarch band of my family was just wiped out, and they both passed away from cancer, different cancers. But clearly had given, and no one chooses to get cancer, but these were women who gave and gave and gave until they really didn't have anything left.
Yeah.
And so that's always in my shadow, in terms of I want to, really be intentional about taking care of myself. And so I go to my tender spots. I could exercise more because I like exercise. And it's like, well, you like it. Why don't you do it more?
Right.
So that's one of the things, because I think movement is huge. And that's one thing we didn't talk about.
Especially with mental health.
Muscle is huge for menopause. You lose a lot of muscle.
Oh, yeah.
So weight-bearing exercise is a huge part about a part of.
And in fact, I was prescribed that recently by my doctor, strength training.
Yes. It's a very, very, it pays back in dividends for women.
Okay.
So, getting back, so, just trying to be more intentional about those things. And I really, really am so much more intentional about my time, who I spend time with, who I let in my inner circle, how that circle supports me. And I have no problems distancing myself from things that don't work for me. Yeah.
Good.
Yeah.
And that is classic over 50 behavior.
That is so over 50.
If it does not serve
yes,
me.
if it does. And no hard feelings.
No hard
I'm
feelings.
Not,
I'm not mad.
I am
at
not
all.
mad.
I'm not mad at all.
I'm so not mad. Yeah, exactly.
Yeah.
And, that was something that maybe as a younger person, I was like, I had this thing where I was just always trying to do and trying to be and trying to whatever. So I would like dig in harder when situations were not where like, oh, I'm just really going to make it work now.
Right.
And now I'm like, oh, it's not working. I'm okay.
Yeah.
I'm okay.
And I'll say for self-care, I learned that It's very important, just like you give everyone else time and space in your life. I suffered a loss. I lost my husband a couple years ago,
Oh, sorry to hear
and
that.
just to regroup, I took a trip, and the listeners have heard me say this. Took a trip by myself, and I went on a cruise where my phone couldn't ring. I just totally shut off from society, except my daughter. She liked my tracker. I had to check in every day because, of
Yes.
course, I went away by myself. But it did wonders for my mental health just to regroup. And one of the things I got out of that was I have to schedule me time. So I would put on my calendar.
I
Now
love that.
you're extremely busy. You have a lot going on, right? Even if it's one day a month, I would put it on my calendar as the Tracy appointment. And I looked forward to that day. And I made sure nothing interfered with that day. And I literally just stayed home in my PJs, chilled to the max, watched movies. It was just a day of nothing. Just to regroup, to just have some downtime.
I love it.
And I would turn my ringer off, I could see who calling, but it ain't important because today is my day. And it did so much for me to do that. And quite honestly, after I kind of got over that hump, I've slacked on it. And now I feel like just even mentioning it and you answering that question, I was like, wait a minute, I need to get back to that.
Yes.
It's
Yeah.
important.
And I think that's important at any age. That's just not for over 50. I
Yes.
think that is, you have to recharge. You have to recharge.
Because what I've learned is people will drain you. Things will drain
And
you.
what I like to say is, you will drain you.
You will drain you.
You will
Great
drain
point.
you.
Yes, you will.
And you have to be, you have to be kinder to yourself. A lot of times, I think that was some of the things that I kind of, gleaned as a, I would say, becoming a woman, like becoming, you're a woman when you turn whatever, but there are stages.
My mother used to say that to me. She would ask me all the time, at 21, are you a woman? Yeah, I'm a woman.
Yes.
She would just say, keep living. And, every so often throughout life, she would ask me that question. But it wasn't until I really just got serious about, she's like, when you know who you are, that's when you're a woman.
Yes.
And I'm like, well, what the hell she means? What does she mean by that? And I really just took time off. I didn't date.
Yes.
I didn't do anything and just really got in tune because I didn't even know what I liked, what I didn't like, and got in tune with myself to be like, now I know what she's talking about.
Yes. And it's a beautiful thing.
It is a beautiful thing.
You can't trade it for anything. It's
because
just,
it creates
it's your peace.
It's your peace.
It's your peace.
It's your confidence. It's your sexiness. It's your you. You know what I mean? It's all those things.
Yeah. And for me, I would give little gifts to myself.
Yes.
So sometimes it was something I'm purchasing, but sometimes it was an experience that I'm allowing myself to have. And it would be, I'm gifting this to you. And that was very powerful.
Yeah.
Very powerful. I have had a lot of girlfriends who have become empty nesters after being parents, and especially single parents, because you're so busy, you spend so much time, rearing your child and working and this and that, when the child leaves or the children leave I was telling a friend, I was like, yeah, the first couple months you kind of looking around like, oh, what am I doing? What is there
now?
to do?
What
And
now? Right.
like, oh. But there's you hit a little breaking point, and when your life opens up to you, it's just,
Let me tell you.
it's awesome.
It is.
It is absolutely awesome.
It is. It really is.
It's so beautiful, the life that we have. And, I think about this all the time because my mother did not get a chance to be 50. And it's just so beautiful. Even when you look back on the bad times, you're like, I made it through that. And, it's a good time to enjoy your life.
It really is. It really is. But you have to do the work
Oh, yes.
to get there. And I think that's what a lot of us women miss. This happiness or this level of freedom or this level of understanding, there's work behind it. And
For
if you
sure.
do the work, and when I say do the work, I'm meaning mentally, physically, like dig in there. What are your issues? What are your traumas that you need to overcome?
Yeah, I
What
agree.
do you need, to make you whole?
But I feel like it's a natural break point.
Yeah.
Like, it's where you're like, okay, that stuck stuff, it's getting old. I'm over it. I'm over it. So I feel like it's a natural break point. And I love that about being a woman is that you do have these biological markers of your world, whether it's your first menstruation to your pregnancy, now to menopause, like you get an internal signal.
Yes.
Like it's time to change, boo.
Right. But again, I think if you tune into that, you'll hear it. It's probably being said to a lot of the listeners now. They're just not listening. Or they're not hearing it loud enough to make a change.
I don't meet very many women like that. I don't because I just feel like it's it is very I'm sure there are women who are, just
I don't have any in my circle either. I just know. And a lot of it will have to do with you, right? Because you are your circle, right?
Yes.
So so I don't experience it now, but I would say I've run into it.
I agree that it does take work and
Yeah.
it doesn't come where I think the opportunity is a natural break point.
Yes.
The opportunity is presenting itself, and it's much easier to move forward into this opportunity than it is to stay stuck. But that's
Yes.
not to say that no one or that all women make that transition.
Right.
But I really believe it's a beautiful invitation to
It really is.
participate in your own life.
It really is. Because I feel like in this season, I'm living my best life.
Oh, for sure. I
Yeah.
told my
Yeah.
baby sister turned 50 this year, and I was like, I'm going to be honest with you. 50 was the best year in a long time.
Yes.
Like 50, I mean, my 50s were so far have been up there with the 30s in
Yes.
terms of happiness. I would say more so because my 30s and 20s were a little traumatizing. But yeah, I would have to say I am happiest.
I would say that
decade.
as well. And it is because I've learned so much, I've been through so much and overcome so much, and at this level of just happiness and freedom and, to move and to do and, all the things I want to move and do.
And the fear is, there's just so much more acceptance.
Yes.
And there's an ease to my 50ness that I did not have before.
Awesome. Okay, so my last podcast, I had my sister on, and I asked her a question, and when I asked her, I said, I need to ask that of every person I have on the show. And the question is, when you hear, girl, I'm making it through, what does that mean for you?
So initially, if you asked me, I would kind of think more of a negative, like, girl, I'm making it through, tired.
I'm struggling.
Yeah, I'm struggling. But having met you and understanding your journey and where you are now, I think it's an affirmative. It's a validation. Girl, I'm making it through.
Yes.
So that's what I receive.
Nice. Yeah, and I will co-sign that because I'm at a space in life where I'm free, I'm enjoying, I'm doing the things that make me happy. I am living my best life right now.
Yeah.
At 50, I'm about to be 55. At 55, yeah.
And I love that for you. I do. I love
Yeah.
that for us.
Yes,
And I
as
want that
as
for
women.
everyone.
Yes, definitely.
Yeah. Wonderful.
Well, we'll wrap up with that. And again, I'm so happy you came. Please tell everyone
Right.
in the Atlanta metro area, how they can find Harmony Wellness.
Oh, you're so sweet. So Harmony is in the beautiful community of Motto in Serenbe.
Okay.
We are at harmonywellnessforwomen.com. You can check out our website. We do telehealth as well as face-to-face. So even if you aren't in our direct area, we will be glad to, quote, come to you. And we welcome you for all services we take most of the major insurance companies for the services that are insurable. And yeah, we're here for you.
Awesome. So again, thank you so much, Dr. Songhai
Thank
Barclift.
you,
And you
Tracy.
guys reach out for any socials that they need to follow, or to go to the website and you'll probably
You'll
be
go to
connected
the website and you'll
to your
get connected.
socials.
We do have a socials, but it hasn't quite gotten all the love and attention it needs. So
Yeah.
I
Well,
don't
it's
direct
growing.
people
You're just
there.
getting it going.
Yes.
And so you're already seeing patients.
Oh, yes, we're
Yes.
definitely seeing patients.
Yes.
We have a full staff waiting. Shout out to my staff. Nancy is my nurse. Simone is a nurse midwife. She's beautiful. She works with me. And then I have some great college students who work with me in the office. So, yeah, we're here.
Well, thank you so much again. And guys, check out harmonywellnessforwomen.com.
Thank you.
Woo, what an inspiring conversation today with Dr. Songhai Barclift. I hope you're walking away feeling a little more informed, a little more empowered, and a whole lot more motivated to take charge of your health and well-being after 50. Dr. Barclift reminded us that our wellness isn't just about checkups and medicine. It's about balance, listening to our bodies, and giving ourselves the care we truly deserve. If you loved today's episode, don't keep it to yourself. Share it with your girlfriends, your sisters, and anyone who needs a reminder that thriving after 50 is absolutely possible. And remember, this journey we're on, you don't have to do it alone. We're making it through together, one laugh, one lesson, and one episode at a time. Until next time, I'm your host, Tracy Marchelle, and this has been Girl, I'm Making It Through. Take care of yourself, sis. You're worth it.
Life keeps changing.